Now it is time to talk feet. You're taught to stand on your own 2 feet and then get your feet wet. And sometimes keep your feet on the ground and keep reaching for the stars. But how much do you really take care of the base of your body?
We have 2 podiatrists with us today who specialize in keeping your feet feeling sweet. Dr. Matthew Jones and Dr. Timothy Short are here from the Carondelet Medical Group. Welcome, gentlemen.
Thank you very much.
Thank you so much for being here. Now, for our viewers who might not know much about podiatry, can you talk about some of the foot and ankle conditions that you treat?
Sure. You know, basically we'll do any foot and ankle injury or condition. So that could entail an overuse injury. It could be a stress fracture or a broken bone, a dermatological condition, tendonitis. And what we're really excited about recently is more of this treatment for peripheral neuropathy, which is a painful nerve condition that causes burning, tingling, numbness in the foot, ankle, and leg.
Wow. And how does that come about?
So basically that's very common with diabetes. That's one of the most common reasons people get peripheral neuropathy. But there's other reasons, thyroid issues, trauma, alcoholism, chemotherapy. So really what we try to do is figure out the root cause of the peripheral neuropathy, then figure out what the best treatment is. And sometimes that treatment is a surgical treatment, which we've all been extensively trained to do the peripheral nerve decompressions, which release the pressure around the nerve. It restores blood flow to the nerve, and most importantly, release pain.
So you treat surgically and conservatively. What are some of the
Yes.
conservative managements you might try before surgery?
Typically, first we have to find the source of the problem, so we'll figure out what's going on to cause this pain or this numbness. Sometimes it's as simple as figuring out some kind of a biomechanical reason for this, so some kind of a reason that the foot or lower extremity is moving inappropriately and that needs to be supported. Other times there are medications that we can use, and other times we discuss surgery.
Okay. You know what? I've seen that. My mom used to wear one of those things that you put underneath the foot in between the toes. What are those things called?
Toe separators?
Well, not separators. Yeah, okay. It's something. I would have to bring it in.
The thing that you, when you get a pedicure.
Right. No.
We don't do those.
So you don't do pedicures? All right.
Not a
well.
chance.
So you also treat sports injuries.
Correct. Yeah, so I was fortunate enough to do a sports medicine fellowship after my residency. So I had the ability to treat high school and collegiate athletes. So that's one of my favorite things to do is treat athletes. And again, that can be overuse injuries, fractures, sprains, the typical things that we see. And Tucson's a very active town, obviously, so we see a wide array of athletes, including hiking and that kind of thing, too.
So you see adults, young adults. Do you see children as well?
We do see children. Yeah, so basically some of the things that we would do for a child, for example, you know, patients will come, or parents will bring their child in for flat feet or, you know, some type of pain. And usually it's a very simple treatment for kids, but sometimes it can be more severe. So it's something that we could just kind of have to evaluate and make sure that it's not something more severe. The other thing we see is growth plate issues with them sometimes. And we're even all the 3 of us in our group are trained to do the casting for congenital clubfoot deformity.
Okay. Well, talk to us. You mentioned flat feet. Talk to us about high arches versus flat feet. I mean, sometimes is it just aesthetics? And if you have no pain, don't worry about it?
Sometimes it is. Sometimes some of these conditions, either flat feet or high arches, they can actually cause pain in different areas of the foot, for which we would oftentimes talk about some kind of an insert for their shoes or some kind of a support for their shoes or some stretching techniques. Oftentimes, if some people are on various ends of the spectrum, either very high arches or very, very low arches, there can be issues. So it would be something to come in and talk to us about.
Because that would stretch into back pain. I mean, basically your feet support your whole body. What are some extreme cases of where, you know, something going on with your foot could show up in a symptom somewhere else in your body first?
Yeah, I always explain to my patients that, you know, things go, like you said, from the ground up. So this is our foundation. So if something's very flat, it's going to affect our knee, it's going to affect our hip, our lower back. So it can work up the chain. So again, depending on what else is happening with that deformity, sometimes it's very benign, and it's something as simple as an insert, like Dr. Jones was saying. Sometimes it's an actual deformity that needs some type of reconstructive surgery to repair tendons or fuse joints and so forth.
What if some of our viewers are thinking, well, you know, I have sore feet. I'm on my feet a lot, maybe, you know, servers, or I'm a performer on stage, so I think my feet hurt all of the time. What are some of the signs and symptoms that maybe you should say, you know what, this might be a little more serious. It's time to actually go to a podiatrist?
Right.
Well, typically, what I tell a lot of folks is, you know, if this is something that starts to affect their life, if people are athletes and it gets painful running or whatever they're doing, or if people have pain at work, and they, you know, most of the time, a lot of the signs, when we have pain, it's a sign that usually something is going on somewhere. If it's not something that goes away rather quickly, usually it's time to have it evaluated and at least have somebody take a look at it and see if there's something underlying that can be treated.
So if it's a lingering feeling of uncomfort or pain, it's time to call you.
Yeah.
And so you said there's 3 doctors in your group. How do we get a hold of you? Where are you located?
Yeah, so basically we're part of Carondelet Health Network, Carondelet Medical Group. So we're very fortunate to be a part of that group because they're primarily a primary care physician entity. So they have offices all throughout Tucson. So basically what we do, we have a primary care our primary office is on 5th and Alvernon. That's our central location. And then we're able to use our family doctor's offices as satellite offices. So we have Northwest, we have Rita Ranch and Vale area, Green Valley, and then Dr. Jones goes to offices by both St. Joe's and St. Mary's hospitals. So we pretty well got it covered.
Awesome. All right. Well, Dr. Short, Dr. Jones, thank you so much for keeping our feet happy.
Thank you for having us.
Make your appointment with the podiatrist at Carondelet Medical Group by calling 319-3283 or go online to carondelet.org. Again, the phone number 319-3283 or carondelet.org.
Still ahead on the Morning Blend, you and your favorite pet could be in a TV commercial. We'll tell you what to do and how to do it.
Plus, we'll turn on the lights, point our cameras, and cause fashion. It's on deck. We'll see the whole look to this dress coming up right after this.